podcast should tell you that it's going live, and okay. It looks like we're live. Should tell you that it's going live. What? And I need to mute that tab. Okay. We are on, and thank you so much for joining us. This is Waters Up, the joint podcast of the Maine Water Utilities and the Maine Water Environment Association, where we discuss current events in the water industry. I got to take a quick minute just to thank our episode sponsor, Team EJ Prescott. Anyone in the industry knows the value that EJP provides. I don't really have much to say other than to thank them. And they're a Maine-owned company that has grown into a reputable national company. And as Team EJP continues to grow and expand, they pledge to continue providing the industry's finest water, wastewater, and stormwater products, all backed by their exceptional level of service. And I got a quick housekeeping item to discuss. For those that are tuning in and looking to receive credits for this broadcast, after the show, there will be a link in the comments section of the YouTube page, as well as a link on the podcast website on through the Maine Water Utilities website. You can click to get to there, where we'll put up a short quiz, and you can simply go in there, fill out the quiz, and submit that, and we will make sure you get your credits. So just take care of that, and anybody can message me after the show and let me know if there's any issues. And with that, I will get started, and I would like to introduce my guests today. First, I have John True. And hey, John, how are you? Checking his audio. There we go.
Yeah, I had muted myself, so I'm doing fine. Thanks for the invite. It's certainly a pleasure to be with this group.
Yeah, sometimes I wish I had that power to just mute people all the time. You know, it is pretty handy. But anyway, John is the Engineering Services and Clean Water State Revolving Fund Program Manager at the Maine Department of Environmental Protection. He's a licensed professional engineer. He has a master's degree in engineering with a 37-year career, which is crazy because he's only 38, at the DEP. Since 2010, he served as the Environmental Engineering Services Manager, directing staff in the CSO abatement program and the administration of federal and state grants and Clean Water State Revolving Fund loans. So, and many people don't know this about John, but he has traveled to 48 of the 50 states, and he's only missing Arkansas and Hawaii. And that will be a quiz question. So
I'd like to go to Hawaii. I'm not sure about Arkansas.
Not worried about getting to Arkansas, huh? So when are you headed to Hawaii?
Not in the immediate future.
Okay. All right. Fair enough. Fair enough. And also with us, we have Bill Dawson. Bill has served as the chief engineer at the State Revolving Fund, at the Maine Drinking Water Program since 2017. He also is the manager of the Drinking Water State Revolving Fund, the Engineering Services team, the Water Resources team, and the Subsurface Wastewater team. So he's got a lot on his plate. Bill's experience includes 36 years of engineering, consulting with national and local firms, where he had many opportunities to lead and manage a multifaceted team of engineering design professionals. Specific programs have ranged from new water treatment facilities, pump stations, water storage facilities, and other infrastructure renewal programs in Maine, New England, and the Northeastern United States. So thanks, Bill, for joining us. I appreciate you coming on. And Bill also, he traveled to Northern Ireland, Belfast, Northern Ireland, not Belfast, Maine, to see Van Morrison on his 60th birthday. So that's pretty cool. So, which is crazy because, again, he's only 55 years old, but and I also understand Bill's got his 40th wedding anniversary coming up this Sunday, I believe. So Congratulations on that. Is your wife happy about that?
She's ecstatic.
Great. So, and lastly, a man who needs no introduction, beloved in the state of Maine, very well known. We've seen him on TV for years. He's our national voice for this small state of Maine, Dr. Nirav Shah. Did I pronounce that right?
You did, Rob, and it's really a delight to be able to join everyone. Thank you for having me on.
Thanks. I'm going to go ahead. I actually pulled your bio from Wikipedia and I thought it was pretty good. So do you mind if I go through that real quick?
Oh, you're welcome to, but I'm just as happy if you want to get straight to the questions, to be honest with you.
Okay. All right. Well,
yeah, let's get right to it.
Okay. One thing that I noticed that was quite interesting though, when I read through your bio, is that you're not only a doctor, you're an attorney. Is that correct?
I'm really predominantly an attorney. It's really what I think of myself as first and foremost. Much of my career was spent practicing and working on issues of healthcare policy, public health law. That's really kind of my real background is on regulatory matters and how they intersect with the healthcare system. So that's really and truly how I come at most of these issues.
Okay, well that's interesting because I'm not sure everybody knew that. I certainly didn't know until I started doing the research for the show, and that I want to ask: Are you a glutton for punishment with that? I mean, you're basically
no, it's I think it was more that I just delayed getting a real job for a long time more than anything else.
Yes, I know some other people who have taken that approach. So, well, I appreciate you getting a real job, at least within the last couple of years and helping us out here in Maine. So thanks again.
It's been an honor. It's been a real honor.
All right. Well, so I did send some questions ahead of time, and I think, we'll somewhat follow the agenda, but I'm happy to veer off and take the conversation wherever it goes. And but I do want to get right down to business. And the first serious question I have is, how much of a threat is Diet Coke to our nation's health?
There's a pretty big diversity of opinion on this. And as you might imagine, I've taken a look at the data, and for folks that don't have pre-existing health conditions, who are otherwise healthy, who exercise and otherwise eat a normal, healthy diet, there is really nothing out there to suggest that diet sodas occasionally, which is what I try to keep it at, have any real tangible health risks. They're like most other indulgences in life. Would the entire world be better if no one ever ate candy, drank any type of sugary beverage, avoided carbs, avoided saturated fats, stopped eating red meat, ran 8 miles a day? And yeah, I think we'd all be better off, but there's a cost that comes to those things. And for me, the occasional Diet Coke goes into that category. So I know that there's a lot of people out there who say, oh, you should drink water. Yeah, I mean, we should all do a lot of things. But no one really does, and there's reasons why we don't. And that's kind of, for me, where I put Diet Coke in.
All right, that's a fair answer, and I can understand that. I mean, I have my indulgences, and I think we all do. For me, I love chocolate, and I'll take it in any form and eat as much of it as I can. So,
well, it's that last piece, and I think it's actually important for the COVID discussion, which is as much as you can, anything that's out of moderation, no matter what it is, whether it's exercise, consumption of vegetables or chocolate or what have you, anything that's out of the bounds of normal consumption, that's a risk. But for the most part, things that are done in moderation don't pose significant risks. The same actually applies to COVID, believe it or not. I mean, one of the things we're seeing right now is people taking their views on COVID and dialing them up to, where they should be at a 1 or a 2, they're dialing it up to a 9 or a 10. So you've still got folks out there who refuse to leave their house because they're terrified of COVID, even though they're fully vaccinated. And then on the other side, you've got folks who are extreme in the other way, who have said, you know what, COVID is and always has been a hoax, and I'm not going to do anything about it. And it's that same kind of extremism, whether you're talking about diet and exercise or COVID, there's just, it's not productive.
Yeah, no, I can certainly appreciate that. And well, speaking of COVID, you did a nice segue for me there. Can you give me a brief update? I think it was something like 230 some cases or so today. Just, Maine's fully opened up. How's things going?
Well, just to kind of start where you noted, we only had 36 cases today. And that's been about where we've been. Some days are going to be lower based on the way that testing happens. Some days are going to be a little bit higher. But we had 36 new cases today. It's a little bit higher than we have been. But again, a lot of that is because of the days of the week that people choose to go get tested and such things. On one hand, things are going really well. We are one of the most vaccinated states in what is right now one of the most vaccinated countries, which means that overall, Maine is one of the most vaccinated places on the globe. That's a pretty good thing. At the same time, we've got pockets of the state where vaccination rates are lower than average. A lot of rural places in the state of Maine have lower than average vaccination rates, which means that we're going to keep seeing cases in those places. COVID's not going to go away in that respect. It's not as if we're going to get to a point where COVID's gone and we don't have to worry about it anymore. COVID's going to be with us for the foreseeable future. If we can get vaccination rates up even more, we can drive those rates down and set ourselves up for a better summer, a better fall. But we're doing better than other states, but I'd like us to do even better than we are.
Yeah, always room for improvement. Yeah. So I did just a little bit of research on my own last week and kind of looked into this because there's a big push for vaccinating younger people, children, essentially ages 12 to 16. And I have two daughters in that range. And I kind of ran some numbers and looked at the American Academy of Pediatrics says it's about 5.3% of children have contracted COVID, so about 1 in 20. Mm-hmm. And then of those, 0.15% or 15 out of 100,000 die, which, anything over 1 is really not acceptable, especially when we're dealing with children. But the math says that it's about 15 out of 2 million children will die from COVID-19. And then I went, and of course, everybody compares to lightning strikes, which is about 1 in 15,300, according to the National Weather Service. So we're about 9 times, a child is about 9 times more likely to get hit by lightning than to die from COVID. Yet there's a big push to vaccinate them. And it seems like maybe that push is in regards to the greater public health or the greater good of society as opposed to their individual health. And I was just wondering if you could talk to me about that. Maybe my numbers are wrong. Give me your thoughts on it.
Well, I haven't independently verified the numbers, but that you noted. But there's also an important number that has got to also be thrown in the mix, which is just the number of people or kids who get hospitalized too. And we focus a lot on those who get sick and die. That's important. But hospitalizations are really very, very critical as well. We've had quite a number of people under the age of 25 in Maine who have been hospitalized, to say nothing of the fact that those who get sick with COVID are really not, they're not in good shape. They've got follow-on effects, meaning they've got to be out of school, which means their parents have to be out of work for weeks at a time. And all of that's got to be factored in, especially set against the safety and the availability of a vaccine. The vaccine is exceptionally safe. It's exceedingly effective, over 93 to 97% effective. It's easy to get. There's no waiting lines or anything of that anymore. And so you've got to look at the risks of COVID, which again, not just deaths, hospitalizations, being out of school, parents being out of work, set against the safety of the vaccine. The other thing you've got to do is keep in mind that we don't quite yet know what the long-term consequences of COVID are. We know that about 20% or so of everyone who has COVID has some degree of long-term symptoms. Now, for kids, that might be lower. We're not quite sure yet, but there's not really yet a good sense of how long the symptoms of COVID may be around for. And for some people, they've been lingering on for over a year now. People who have reported that they're not back up to their normal selves, so on and so forth. So when you consider that, and you consider the unknowns that we don't know about in the future, compared to the extreme safety and effectiveness of the virus, for me, even on an individual per child basis, it's a no-brainer. But when you add on top of that the public health benefit that you mentioned, the fact that kids who are unvaccinated, even though they may not be as sick, could inadvertently pass the virus on to other people in their community. They could inadvertently pass it on to a grandparent who might experience a breakthrough case and perhaps die. That just adds on to all of this, the imperative why I think it's not just me, but why pediatricians across the country believe that vaccinating kids is really important. You know, I'm not a pediatrician, but pediatricians in Maine are pretty universally in agreement that vaccinating kids is important. We trust pediatricians for just about everything else out there. It's kind of curious to me that all of a sudden, when it comes to vaccinations, we don't trust doctors, even though, can you imagine a world where your wife or your mother had cancer and we took them to an oncologist and listened to the studied opinion of an oncologist, and then instead of listening to that oncologist said, well, hey, you know what? I did some research on YouTube and Facebook and I ran some numbers on my own and I think you're all wet. We would never say that, right? But for some reason, when it comes to COVID, we think it's perfectly normal to say, hey, doc, you know, I know you went to medical school and I know you did really well and I know you studied and trained, but I watched a video on YouTube and I think that person's right, not you.
Yeah, I think there's something to say about the time. You know, there's still a lot of questions, and I know COVID's been around for a year and a half, almost 2 years now, and so I think people are starting to gain that trust. But I think with anything new, there's this inherent distrust, and of course, we also have YouTube and Facebook and social media, and we didn't have that stuff 15, 20 years ago to kind of sway our judgment. So that's a very valid argument.
Well, it's an interesting situation because one of the changes that COVID has brought is a change in what it means to be considered an expert in something. I mean, again, we could look at this from the world of many of your viewers right now, which is imagine someone calling up you, Rob, or any of your viewers and saying, hey, look, I know you've got 5 to 25 years of experience in water safety and water control and providing fresh, clean drinking water to the people of Maine. But, I saw this guy on Facebook who said that all of those chemicals you're putting in are causing all of these problems. And so I don't think you know what you're talking. Like I think people would say, well, okay, but does that person have credentials? Did that person study engineering and chemistry and physics? And, that's kind of the world that I think a lot of doctors are in right now. You want to respect people's diversity of views, but you also want to say, but hey, does that other expert out there, do they really know what they're talking about?
Yeah, the keyboard warriors. I think though in the water industry, we're dealing with it with fluoride all the time.
I was just going to say, it reminds me a lot of the debate that seems to pop up every so often about the safety of fluoride versus the benefits of fluoride. And look, there's room for good, scientifically driven discussion about these things, but I think the challenge that we've got right now is separating thoughtful scientific analysis and discussion from that guy on YouTube.
Yeah, which is hard to do sometimes. So I'm gonna shift gears a little bit if you're good with that, and I want to touch on wastewater epidemiology a little bit. We've been testing our wastewater at the Brunswick Sewer District, and we've done it for 6 weeks or so, and we get some numbers back, and I don't really know what the value in that testing is bringing. So So why should sewer districts be testing, for COVID or whatever else in wastewater?
Yeah, that's a good, I'm really glad you raised that, Rob. And I think this is a pretty evolving area of science. Wastewater testing in general, but specifically COVID wastewater testing, because interpreting changes week by week, it's hard to do. And then it's difficult to know what those changes mean. And the biggest question is, it's difficult to know what to do after that. Right now, our approach, working with Mike Abbott, who many of you know here at Maine CDC, has been to think about wastewater testing first and foremost on an institutional level. Here's what I mean. We're starting our thinking around wastewater testing by focusing on buildings where people live. Because if we detect a spike, then we can do something about that. One of the places that we're starting that in earnest right now is working with our colleagues at the Department of Corrections and the state prisons across the state of Maine to conduct wastewater testing block by block, cell block by cell block, prison by prison. That way, if we see a spike, we can immediately switch to universal testing of all of the people within those buildings. We're actually doing that, starting that pilot process right now. And we're hoping to build it out over other congregate facilities like dormitories and maybe even nursing homes and facilities like that. That is for us, as Mike and I have analyzed this, that is for us the principal value right now. There's probably also a value in municipal level wastewater testing, but I think we need more research around what that means, what the spikes might mean, and then what public health interventions might come after that.
Okay. I actually had quite a few follow-up questions regarding the value of wastewater epidemiology and how it's applied, and you kind of covered it all in one with the prisons. That's a great example. So I do have one question that my trustees are constantly asking me, because I report our wastewater test results to them every month, and we get their lab report back and it says colonies, and I can graph the colonies and I can compare that graph to the active cases in Brunswick area, and it's very similar. So you can just see the rise and the fall as the case numbers move along. But what exactly is a colony, and does it correspond to like a specific number of cases or per person?
Well, the notion of testing this by colony comes, I think, from the way that bacterial testing occurs, which is in so-called colony forming units, or CFUs, which is essentially an agglomeration of bacteria that are easier to spot rather than trying to count each individual bacterium itself. And I think the same analysis applies with viral colonies as well. It's essentially a clump. But, going back to this value of municipal level testing, the other thing that I think is important, Rob, is testing of humans. Human testing has gone down pretty significantly in Maine, across the country, because here in Maine, of course, we've vaccinated so many people. So it stands to reason that once we've vaccinated people, we don't need to swab their noses anymore. With that reduction in testing, we don't have as much of a view of what might be going on. And that's why I think another reason why wastewater testing is pretty important, because as we back off of human level testing, doing the wastewater testing helps us keep that surveillance up so we know what's going on, and at least we can be prepared for the possibility of spikes, say, as we go into the fall. We can give the hospital a heads up to say, hey, look, we have detected a huge increase in wastewater samples over the last 96 hours. So if you've got a person coming in the ER, think about COVID, and maybe we can tell others to do the same thing. That's what I think the wastewater testing is going to be useful for as we go forward. That way we know, and we can give providers a heads up to be on the lookout for COVID. The other thing to think about, Rob, is why just COVID, right? Maybe we should be thinking about wastewater for influenza and RSV and other viruses that are out there. So similarly, we can start giving providers a heads up. That's been something that's on my mind lately.
Yeah, well, I think we'll have to follow up a little bit more on this. This wastewater epidemiology is kind of new, at least to my district, and I think most of us in the state. But we're more than willing to participate and try to collect this data and be a part of the solution. And so we're more than willing to help. I know we're running quick up against the hard deadline here, so I do want to just take a minute. And I don't know if you're aware or if you've seen. You should see a screen share pop up any second here. I don't know if you've seen this photo around anywhere, but this was actually painted by my aunt, Shelby Krause, who's a resident. And,
wow. You know what? I don't know that I have seen that, to be totally honest with you. That is really touching. Kind of at a loss for words. But please convey my gratitude to your aunt. That is really something. Wow.
Well, I'll let her know. Hopefully she tuned in today, but she's probably vacationing down east, so she may not have. But I could probably arrange a copy of that to get dropped off to you somehow if you want. So maybe after the show I can get in touch with you or through Peggy and we can see if we can make something happen.
Well, that's very touching and extremely meaningful. It's pretty, it's emblematic of the reception that my family and I have gotten since we've moved to Maine. And I'm again at a loss for words. I'm really touched.
Yeah. Well, I hope that gives you a little bit of a understanding of how much you are appreciated, and I don't think it matters, whatever you think of COVID or however you stand on vaccines or whatever side of the political aisle on, we all appreciate you being here in Maine. You're a true scholar and a gentleman, and I really want to thank you for coming on the show and for everything you've done over the last couple of years. And I know it's been a rough time, as it has been for many people, but you've persevered and you've been a shining light at the end of the tunnel for all of us, and I appreciate that. So thank you so much. I really appreciate the opportunity and appreciate your kind words as well. Yeah, well, thanks so much, and you more than welcome to stay, but I know you got things going on. And my apologies, but this is fun, and I look forward to coming back and talking about wastewater testing with you guys. Okay. Yeah. I'd love to see if I could get you in the future. And thanks again. We'll make it happen. Take care. All right. You too. So there we've lost Dr. Shaw, and I do have Mike Abbott was kind enough to join us on the line again. And Mike kind of headlined our first episode for us. And Mike, you're welcome to come in and turn the camera on and join us here if you'd like. But if not, that's okay too. I'm going to there he is. Thanks, Mike. And thanks for setting this up. Mike is a friend of mine, and I leaned on him pretty hard to pull some strings for me and help get this podcast going. And he came through. So thanks so much. And thanks to Peggy and I am going to take another minute just to do a quick sponsor break, because none of these things are possible without funds from our sponsors. So again, I need to thank our episode sponsor, EJ Prescott. I've been working in different roles with people at EJP for the last 20 years. And I can't think of a single time that I've met with anyone there and didn't come away smiling. They have a fantastic crew that provides an exceptional level of service. Personally, I've dealt with Robbie, Keith, Joe, Jason, Robbie, Dan, Ray, Steve, Mike, Reggie, and even Peter himself. And that's just to name a few. And all of their associates are top notch, and even better, they're extremely creative. And if you're ever looking for a solution to a problem, no matter how unconventional it may be, doesn't even have to be water or pipe related, call Team EJP and they'll figure out a way to help. So again, I need to, thanks for being a sponsor, and I appreciate them pitching in here. So next on the topics was PFAS. I was going to do a little bit of a follow-up about that, but I don't know how interesting of a topic that is. Whenever I hear PFAS, I start to snooze off. So but anyway, I've got Bill, John, and Mike here now, and one of the things I want to point out about PFAS is that when we're talking about the pollutant, we're talking parts per trillion, which essentially is a million times more accurate or a degree of measurement that we were able to test to in the past. When traditionally, when we're talking about pollutants and so forth, we're talking parts per million. So when we're talking 12 to 70 parts per trillion, do we really need to be concerned with small levels of PFAS in our ecosystem? So I don't know if the money guys, John or Bill, want to chime in on that, but and I know Mike's probably got an opinion on it, so I'm happy to hear from any one of you.
I'm happy to take a quick shot at that, since I've been sitting in many meetings with toxicologists and legislators and everyone else discussing these issues. Yeah, you're right. I think someone showed me a calculation that 20 parts per trillion, which is likely to be the new interim drinking water standard in Maine for PFAS, is the equivalent of 1 drop of water in an Olympic-sized swimming pool. So, you're talking very, very small amounts. But we have to rely on the work that the toxicologists are doing around the world to study the health effects. There's still a lot that's unknown about how these are absorbed into the body, what the effects are. I mean, they're linked to several different health effects: kidney, liver, other types of nervous system issues, and possible carcinogenic effects. But a lot of that is still evolving. But for some of the more well-studied chemicals, there's a scientific consensus on what is and what is not a safe level in water and foods. That being said, as you know, there's still no federal maximum contaminant level for drinking water and for PFAS in drinking water. There is a health advisory for 2 compounds, and now in Maine, and this is relatively new, fresh out of the latest legislative session, Maine is adopting a new requirement for public water systems to test for 6 different PFAS compounds, and there's an interim standard of 20 parts per trillion for those 6 compounds combined. So when you test your water, this is for community water systems and non-transient non-communities like schools and businesses that are regulated public water systems. You will have to meet that standard or do increased monitoring and mitigation, which typically involves carbon filtration or finding an alternate source. And so potentially, very expensive, millions of dollars for the one large public water system we've had that had to install treatment for one of their wells ended up being Bill can actually answer that. I think it's about $1.5 million project, right, Bill?
1.8. Yep.
Yeah. So we're talking, a problem that we're just beginning to evaluate in terms of its prevalence in Maine. And we certainly in the Fairfield area now have a lot of private well impacts and impacts to dairy products associated with spreading of highly impacted biosolids in that area. But we're also going to be looking in more depth now at the public water system. So hopefully we're not going to find a lot, but where we do, it's likely to be translating into some money.
Okay. Well, that's good. And that'll kind of segue into the ARPA part of the podcast, which we'll move on to Bill and John. We'll get their input in a minute. But so I think you kind of touched on that a little bit though with PFAS. One of my questions was, what are the next steps? And I think you touched on it with, it's more of at this point, it's a monitoring and gathering information session. And then once we get more data, we'll be able to accurately set some limits and understand how it affects our health. Is that a fair analysis? My simpleton analysis there?
Yeah, not simpleton, but it's a very good analysis, Rob.
Okay. Well, it's similar to what we're doing on the wastewater side with phosphorus and nitrogen and so forth, before they can set a limit on us. And I don't have my buddy Brian here today to back me up, but they need the data before they can give us some rules. So I appreciate that, I guess.
I would say that's true, and that's the typical process for establishing standards, and that's what is happening at the federal level albeit at a very slow pace. However, the many states, including now Maine, have sort of jumped ahead of that process to some degree and established through the legislature some standards that we will now have to go by. So the science and the regulation are kind of moving together, I guess.
Well, it's better than the regulation ahead of the science, which we have seen in the past. So, all right, well, great. Thanks for that, Mike, and thanks for chiming in to kind of fill in the blanks for me here. So yeah, segue into Mike mentioned that some of this may translate into some federal funds. We all know that there's the large ARPA bill has now passed Congress, and there's a few, I guess I don't remember what the final number was, but it's in the trillions, I believe. How much money is going to be available to the state for both the drinking water and wastewater program? And I don't care who goes first there. We haven't heard from you at all. John, maybe you want to chime in first?
Sure. Yeah, I've been following this for a while, and it's kind of like a bouncing ball, ups and downs. You learn more information. Sometimes you learn more information and you have more questions than you have answers. But there was, out of that $1.8 trillion American Rescue Plan Act, about $350 billion is coming to states and local governments. And Maine is getting about 1.5 billion of that. And that's going to come in two tranches, basically a payment this year and a payment next year. I think we might have received a payment already, have gone out to the local governments and things like that in May, but I can't be positive about that. But overall, the state government is getting just a little less than $1 billion, 997 million for this program. And counties are getting a direct payment from U.S. Treasury of $261 million. Metropolitan cities, which we have 5 of them, Auburn, Bangor, Lewiston, Portland, and South Portland, they're splitting $121 million coming directly, again, from U.S. Treasury. The other part goes to non-entitlement units of local government, so often referred to as NEUs. And those are generally populations under 50,000. Our town, which is most of Maine, right? Other than those 5 entities I just talked about. So that money is actually coming to the state. And the state has to figure out a methodology of distributing those funds. I was just talking today with the state controller about what's their plan, and they're working on it. The state actually had to request an extension of time, and they have till, in theory, August 3rd, but they'll probably request another extension before they can distribute those funds. And the reason is that they have to set up a web portal. They have to go out, solicit a vendor or contractor to do that work, to set up a process so that the towns can apply to the state for that funding. So that should be coming, my opinion, not official at all, sometime I want to say probably in August. And then those funds will go out directly to the towns, cities for them to use. One of the things that's interesting about this whole process is that a county can take their money or a portion of it and give it to the towns within their counties. They can't give it outside their counties, and towns can't take their money and give it up to the counties, but everybody can pass it down. And towns can take those funds and give them to people that do work in their towns, like a district, a water district, a fire district, a wastewater district. So that's kind of a nice concept of that funding.
So are there strings attached to this? I mean, like you mentioned, like money's coming in right to the county. Can the county just use it to offset taxes, or does it have to be used for a road project or a jail or something like that?
There's 4 purposes that they can be used for. And I'm going to glance at my cheat sheet here because 3 of them are COVID related. And one is to provide assistance for negative economic impacts. And that can be to businesses, tourism, even individual residential people. Another one's to pay premiums for eligible essential workers or provide grants to companies that provide those services. And the third COVID related is for a reduction in revenue. Let's say the towns don't get as much revenue coming in for their
Excise tax or
whatever, yeah. So they can offset that. It can't be used to offset general tax revenues. It has to be COVID related. And the fourth thing that they can use it for is what we're interested in is, water, wastewater, and broadband infrastructure. So the funds come to the towns, the cities, the metropolitan areas, the counties, and the state, and those entities get to decide where those funds go. So a wastewater community could solicit funding from their town, say, hey, I need a little more money for this upgrade, water or wastewater. Do you happen to have any, can we get on the list? I guess that's a short of it. And then, as I think we've also talked about too, is Governor Mills' main rescue plan, main jobs rescue plan. Exact title is, sorry. Oh yeah, main jobs and recovery plan. Sorry about that. So she came up with a plan of how she was going to disperse the funds. The governor was going to do that. I believe that has to be approved by the legislature. Not exactly sure of the status of it right now. I'm not aware it's been approved. But after that, she kind of laid out a plan for $25 million to go to drinking water, which Bill can talk about, and $25 million coming to the Department of Environmental Protection for two different programs. One is our small community grant program, which helps replace septic systems around the state. And 3 million of the 25 is going to that. And the other 22 is going for what we think of as our normal wastewater infrastructure projects. I suspect that's going to be in a grant form going out.
okay.
At some point.
So one of my questions that was coming up from that, you talked about the funds getting dispersed, and is there a decision maker at each level? It sounds like the governor is making the decisions based on for the money that's coming into the state, but then it goes to the county, and then someone at the county level has to make a decision on what goes to the towns, and so on and so forth. So do I have, as far as the clean water and the drinking water SRF programs, I think I have the two decision makers right here on the show. Is that correct?
I'd say yes.
All right. So
As best we can.
Can I get myself on the top of the list?
I don't know. That's a good question. I'll tell you we were in contact, the department was in contact with the governor's office, and put in for a certain amount of funding for this. As I said, it's going to be distributed in two different fiscal years. And so we're assuming that we have roughly half of that available this year. There was a lot of questions as to how to disperse those funds. And I think that our department came up with a very, very good method for that. We have the Clean Water State Revolving Loan Fund program. And I just add that Treasury's interim guidance or final guidance on this says that projects need to be either eligible for clean water or drinking water SRF to get any of those funding. So we're pretty much connected. So we had just gone through a process of soliciting projects for our, let's say, $50 million of funding that we were going to have available this year. We got $232 million worth of requests. So we made a short list of that, which is fine. But what this all leads down to is that in the Clean Water SRF program, we're able to give a certain amount of principal forgiveness away for affordability to help people do those projects that otherwise could not afford them. Since we're an environmental agency, we prioritize those based on environmental needs, and we could never have enough money to get down to the people that have lower environmental needs, but still need the money very much to do their project. They're trying to do the right thing. They're trying to upgrade a pump station that hasn't fallen apart yet. but it's 35 years old, right? So what we did or proposing, hasn't been finalized yet, but it's pretty much finalized, is we're going to work our way down that list. So we were able to hand out $4.4 million in clean water loan principal forgiveness. We're going to take the ARPA funding grant money and work further down the list to the tune of another $12.8 million and offer that to get those projects done that are hanging. You know, a lot of them are in the county. They're hard hit with a lot of things up there. They're not all in the county. They're spread around the state. There's some on the coast too. So that's our game plan for this year. Next year, we're not sure what we're doing yet. PFAS is the big issue. Maybe that's going to take up priority. We have some other potential funding, federal funding for emerging contaminants that's coming. There's a lot of things in the wind out there right now that need to be decided on some level so we can proceed forward in a sensible manner.
Okay, thanks, John. And Bill, I want to have you follow up on that, but I just have two quick questions that came in on the chat. John, are the ARPA funding, is that all grants or will some of that loans? It sounds to me like this is all grants, what's coming from this program.
Let's assume it is grants, and I'm reaching out to the Department of Finance, Administrative Finance on that. I assume it's going to be like our typical grant program that we have from bond referendums. The difference where it might be is that those referendum bonds that we get are tied by statute to how much we can give for like design. We can only give 25% for design, right, and we can only give up to 80% for construction. I'm not aware of any limits coming in on that funding to us. There might be, we might have to apply that, but I'm not aware at this point there is.
Okay.
The other couple of things that might be good to note, and I know you have another question, is that although it says you have to be, your eligible project has to be coincide with the clean water, drinking water eligibilities, we do not have American Iron and Steel. We do not have Davis-Bacon wage rates associated with this funding unless it comes in with co-funding from somebody else. And actually, we don't have to do environmental reviews.
Okay. John, you should have led with that. that is the single most important piece of information of this whole podcast right there was the fact that you do not have to follow all these in my words only ridiculous standards with that and strings that come with all this money. So Bill, I want to give you a chance to talk, because I know I've kind of had, and John, those fantastic answers. I mean, very thorough and in-depth coverage of what we're talking about with ARPA. So I think you gave a lot of understanding there. Bill, how's this corresponding? Is that similar to what's going on the clean water side? And can you talk a little bit about how you want to disperse your funds and so forth?
Sure. Yeah, we've gotten word that we're receiving 25 million in two payments, 12.5 and 12.5. I believe that the first 12.5 is in the state treasury from the federal treasury. And we've been developing how we're going to disperse those funds. I wanted to be careful. What I did was I developed some proposals, and then we met as a team. The drinking water SRF people at DHHS to discuss the pros and cons and am I creating friction points with the people who are actually doing the payment disbursements and all that. And what we've come up with is we're going to reserve a little money for administration. We're going to put aside some money for emerging contaminants. And we're also taking on a big project with lead in schools. And we're hoping that we can use some money for mitigation where we're running into that. And then other imminent threats to public health. We're a health-based organization, so that's how our ranking system works. We kind of had a feeling that there would be some stimulus money tied to the recovery from COVID. And so we had delayed, we do our funding on an annual basis when we take in applications. And we added 3 weeks to the time period and got a bunch of applications last year, $75 million worth. And they were competing for about $16 million in funds. And so we funded what we could. Now the plan is to extend that list, kind of like what John was talking about, by adding some principal forgiveness to the projects on a flat basis. This year, we're looking at adding 30% principal forgiveness to every project on the list, which will add that $5 million to the bottom of the list. And then we're also looking at $10 million for next year's projects. So if you're on the backup list, we're asking you to reapply for next year's money. And we're adding $10 million to that. And then in the following year, we're going to do another $5 million added. So it's $20 million of the 25 will be added to, will be blended with the drinking water SRF funds. I've understood, and this is different from what John said, that we need to have American iron and steel in all the projects, but we do not need Davis-Bacon or the environmental reviews. But where we are blending it with the drinking water SRF funds, we're going to need it for $20 million of it. We're going to need all the regulations. Okay. But it's a way we've already developed how we can deliver the money, so, and administer it. So that's the lion's share of the money.
How do you know which projects will have all of them apply or will have some of the regulations apply? Is that going to be your decision, or is that just, it depends where the money comes from? How will that work out?
Well, anything that is blended with drinking water SRF will have all of the regulations that apply to drinking water SRF, which will more than cover the ARPA money. And then the $4 million that we're putting aside for emerging contaminants, lead mitigation, threats to public health, that only has to have the regulations that apply to ARPA, unless it's blended with money that's coming from another source.
Okay. And you mentioned something earlier about some of the funds going to emerging contaminants. Is that what Mike was talking about regarding PFAS, or are there other emerging contaminants that I need to start worrying about?
It's really directed at PFAS without saying PFAS, put you to sleep.
Okay. Well, it's kind of, PFAS is kind of one of those trigger words for me, you know, like we all have these things that trigger the gag reflex, and that's one of them. And honestly, it's not necessarily the contaminant itself, but it's how it hit the industry, you know, a year before COVID. I guess it was 2019. It's all of a sudden it's like, hey, stop spreading and stop doing everything. And it, you know, kind of blindsided us. So it's definitely a trigger. It's definitely a word that bothers me, but I understand that we need to address it. And you know, our job is the public health. So we're going to do what we can to mitigate these risks. That pretty much covers. I'm about running up against the hour, which is great. The time flies by fast. Is there anything else regarding ARPA funds that I didn't ask questions or? I did actually. One other question I did have was: is this for projects, or can some of these funds be used for equipment?
I can answer that. If it's eligible under either the clean water or drinking water as equipment, it could be used for equipment.
Okay.
So I'm going to definitely check into what Bill said about the American Iron and Steel. I might have missed that out of the 131-page Treasury guidance. So yeah, I can go back. Yeah, no. There is a couple things that I'd like to quickly say. My wife accuses me of always wanting to talk too much, but
Yeah, I'm going to
had
cut you
asked
off in
about-
a minute.
All right. When do these funds have to be spent? I think that's important. If you actually look at the law, it talks about, they have to be expended by December 31st of 2024. But if you actually look at the guidance, it has to be obligated by then. Then if you look at the definition of obligation, it's basically a contract. So these funds have to be under contract, I assume, at a local level, like the ARPA funds did, by the end of 2024. But Treasury recognizes that it takes time to build these things. So we actually have until the end of 2026 to complete the projects.
Okay, that's great information. And I think that takes a little pressure off, because I was wondering if I need to get back to the office this afternoon and start scrambling my projects list and get things in motion. Bill, I got a question for you actually too, Bill. So I'm going to turn it over to you for the final remarks, but will small investor-owned community water utilities be eligible to participate in the drinking water program ARPA funds?
Yes.
Okay.
Yeah,
All right.
as long as it's a public water system, yes.
And you had something else to.
I wanted to add one other thing. You had mentioned that you wanted to find out if it had to be shovel ready.
Yes.
I was on a podcast that was discussing these funds, and they used the word shovel worthy rather than shovel ready. So it's a loose. It's because of the time frame that John spelled out.
Okay. All right. That makes shovel worthy. I'm going to start throwing that one around.
You're going to look like a big shot.
Yeah, that project's not quite shovel worthy, but we'll see.
Do we want to be building projects that aren't shovel worthy?
That's kind of what I was thinking, but
There are green projects out there.
That's true. That is true. Okay, and we had, just so people know, there's over 40 people watching live, and the last one was watched by about 60. But this is kind of a vacation week, so I think we're doing okay. And then I think we'll end up with a couple hundred views when it's all said and done, which is growing. We'll get there. But thank you all for coming on, because this is very valuable information. I think once word gets out that this is kind of the shortcut and the easiest way to get the quick answers, I think we'll gain in popularity. And I really appreciate everyone coming on as guests and sharing some personal info about them. And Bill, I hope you have a fantastic anniversary on Sunday, and well, I hope you all have a great weekend actually, and things go well. And lastly, I do need to thank my sponsor again. They pay good money to help with this show, and it's a big part of what we do at Maine. The main reason I started this program was to help bring in funds for Maine Water Utilities and Maine Water Environment Association. That's not the main reason, but that's part of it, as well as getting information out to our listeners. But EJP, none of this would have been possible without their support. Actually, everything Maria and Maine Water Utilities do is pretty much sponsored by EJP, and they're not just a vendor; they're a partner in our industry. And I truly appreciate everything that they've done to help us out over the years. And with that, it is an hour. There's nothing that says I can't go over, but I do think we lose people's attention over a certain amount of time. Unless there's any other extra parting words, I'll go around one more quick time, and otherwise we'll wrap it up.
Rob, thank you for doing this, and thank you for including me.
Oh yeah, well, you're welcome. And I'll throw Mike on this one. He's the one that directed me to you as well. So I could give all the credit for the guests for the show to Mike Abbott, and thank him as well for coming on. And actually, I think he's the one that suggested John as well too, I believe, way back on the first episode. So yeah, thanks again, and probably seeing everyone in a few weeks.
Thank you very much. It was very worthwhile and germane to a lot of the questions I'm getting.
All right. Well, I appreciate that. All right. Take care, everyone.
You too.
End this thing.